Hi, today my name is Elizabeth Guzman. Today I will be talking about hematologic malignancies. Hematologic malignancies are forms of cancer that begin in the cells of blood-forming tissue such as the bone marrow. It also um, affects cells of the immune system. Examples of this cancer would be, for example, chronic leukemias, lymphomas, multiple myeloma, and several other syndromes that are from this sort of hematologic malignancy. Although many symptoms of any other illness could be misinterpreted, some symptoms that are caused by these hematologic malignancies would be, for example, appetite loss, decreased urination, easy bleeding and fractures, enlarged lymph nodes, and fatigue. Those are the symptoms that are included. Since these hematologic malignancies are types of cancers, the treatment for them would be chemotherapy, radiotherapy, antibiotic, bone marrow transplant. The bone marrow transplant would be because it no longer functions the way it should, and that's when they would do the transplant. Either it could be donated or it could either be theirs as well. Those are the treatments. Although these malignancies are generally seen in ages 65 to 70 years old, it is first discovered in an individual's bone marrow. An example that I read was a 12-year-old named Robert that started experiencing headaches, fever, and fatigue. They did some clothes testing after some weeks of seeing that he had lost some weight, and he was diagnosed with leukemia, which is characterized as a hematologic malignancy. Now, can hematologic malignancies be cured? Well, in the past 10 to 20 years, as we all know, technology has played a big role in medicine. That is why they are finding new cures to these illnesses such as cancer, any type of cancer. There is certain medication, for example, like chemotherapy, that would put a patient on remission and actually get rid of the cancer. Although many people do get cured from this illness, many people aren't so fortunate. Many people lose the battle to these cancers since it depends where and how fast they actually find the illness. You can pretty much find a support group for any type of illness that you might be going through, but when it comes to cancer support groups, they might start in your caregiver's office. They might have counselors that are there to support you and give you that emotional help that you might be needing, and you could also go online with support groups. They have meetings. You could meet These patients could meet with other individuals that might be going through the same situation or might be in the same situation with these illness, with the cancer that they might be having. Can this disease be stopped from arising? Well, hematologic malignancies, since they're cancers, they can just arise at any time in your lifetime. Many people say that if you prevent having infections and illnesses that get out of hand, this would help you from getting any type of cancer. There's many foods that cause a lot of this illnesses, foods that cause cancer, drinks that cause cancer. So it mainly is how you take care of yourself, what type of infections you take care of, and what kind of medications you take, because in these nowadays, any medication that you take could also cause these type of cancers. Although it might be hard to manage these hematologic malignancies, these cancers, people the bad news about it is that these cancers do come back. Sometimes they come back even stronger, where the patient no longer responds to the chemotherapy or radiation, the medication that they are given to kill this cancer. Sometimes they also come back in different areas, or they take over your body, these cells. Some complications that individuals might have with this type of hematologic malignancies, with these cancers, are post-transfusion purpura infections, delayed hemolytic transfusion reaction, altered oxygen affinity, and allergic reactions. Some complications are because of the chemotherapy, because of the medication that they are given. When you are put on medication, when you have cancer, the chemotherapy really drops your immune system, causing you to get more infections easier and faster than any other individual would. Um, you could get you can be around big crowds of people, not knowing if they're sick of a cough or a cold that you might get and have a complication after because of this illness. Some important information about hematologic malignancies to leave you with is um, most of the time the doctor will tell the patient they either have to get checked every month, every 3 months, every 6 months, up to every year. Um, this is a reason, this reason being because these cancers do come back. And like I mentioned in the other slide, they come back stronger than the first time. So that way you have to come back, get checked, whether it be CT scans, MRIs, just to make sure that the cancer is not there any longer. This is the end of my presentation on hematologic malignancies. Thank you for watching.